Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, ministre de la Santé. Dr. Russell.
Merci, Bruce. Thank you, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Le virus responsable de la COVID-19 continue de se répandre dans l'ensemble du Nouveau-Brunswick. Pour la deuxième journée de suite, j'annonce aujourd'hui qu'il y a un nombre record de nouveaux cas dans notre province. Les grappes d'infection qui ont pris forme durant les fêtes continuent de croître et de se répandre. Au Nouveau-Brunswick, il y a présentement 92 travailleurs de la santé qui sont absents du travail pour des raisons liées à la COVID-19. Cette situation crée des difficultés supplémentaires pour notre système de soins de santé. The COVID-19 virus continues to spread across New Brunswick, and today, for the second day in a row, we are reporting a record number of new confirmed cases in our province. Clusters of infection that started during the Christmas holidays continue to grow and spread. And by spread, I mean that the people who were initially infected at these gatherings then infected other people, and then they have come into contact with other people. So we're seeing transmission in different layers now. There are now 97 healthcare workers off the job across New Brunswick for COVID-related reasons, creating further hardships within our healthcare system, for example, cancellation of elective surgeries. We have in certain areas. We have a renewed outbreak at Parkland St. John impacting a section of the complex that was not touched in the earlier outbreak. And I just want to give a shout out to the prompt team who has been working really hard. They were the ones that worked at the last outbreak and are redoubling their efforts with this outbreak. And as grim as it looks today, things will likely get worse before they get better. I don't like to say that, but that is a reality. We must get serious about slowing the spread of COVID-19 virus. Everyone must act now to follow public health guidance and advice. The alternative is hundreds of new cases every day, as is now being seen in Maine, Quebec, and Ontario. And I know that nobody wants to see that. The alternative is hospital beds filled with COVID-19 patients and healthcare workers overwhelmed by the strain of caring for them and then not being able to care for other healthcare issues such as cardiac problems, trauma, etc. The alternative is even stricter public health measures to counter the spread of this disease. L'ensemble du Nouveau-Brunswick se trouve présentement à la phase d'alerte orange du plan de rétablissement. Pour revenir à la phase jaune et éviter que la province régresse encore plus loin à la phase d'alerte rouge, nous devons redoubler d'ardeur pour empêcher la COVID-19 d'avoir une emprise encore plus ferme sur la Nouveau-Brunswick. Aujourd'hui, j'annonce qu'il y a 31 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il s'agit du plus grand nombre de cas signalés en une seule journée depuis que nous avons annoncé notre premier cas le 11 mars 2020. Ce montant vient fracasser le nombre record de cas signalés hier, soit 27 cas. Les cas se repartissent comme suit. Il y a 6 nouveaux cas dans la zone 1, soit la région de Moncton et sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, de Kings et de Charlotte, il y a 18 nouveaux cas. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a 3 nouveaux cas. Il y a un nouveau cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. Il y a 3 nouveaux cas dans la zone 5, soit la région de Campbellton, Restigouche. Il y a présentement 110 cas actifs au Nouveau-Brunswick, dont une personne est hospitalisée Je vous demande de garder tous ces concitoyens de New Brunswick dans vos pensées et vos prières aujourd'hui, et aussi ceux et celles qui sont à la maison à un moment-ci en auto-isolement. To get back to yellow and prevent the province from sliding into red, we must all redouble our efforts to prevent COVID-19 from getting an even firmer grip on this province. Today, there are 31 new confirmed cases of COVID-19 in New Brunswick, and this is the largest number reported in a single day since our first case was reported on March 11th, 2020. This breaks the previous record of 27 cases, which stood for one day. The new cases are as follows. In Zone 1, which is Moncton and Southeast New Brunswick, 6 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, 18 new cases. In Zone 3, which is the Fredericton and Central New Brunswick area, 3 new cases. In Zone 4, which is the Edmundston-Grand Falls region, 1 new case. In Zone 5, which is the Campbellton-Restigouche region, 3 new cases. There are now a total of 110 active cases in New Brunswick. There is 1 individual in hospital, and I ask that you keep all of these New Brunswickers in your thoughts and prayers today, as well as all the people who are self-isolating at home. The rise in cases underscores the need to protect our fellow New Brunswickers from COVID-19, and in particular, those who are least able to protect themselves. Those living in adult residential facilities are vulnerable for a number of reasons, and we are working hard to control the spread of the virus in these locations. I can advise you that recent follow-up testing at Tucker Hall at the Parkland St. John complex has unveiled 15 new cases of COVID-19. These new 15 cases consist of 11 residents and 4 staff. It is still an evolving situation, and residents are isolating. The PROMPT team, which is the Provincial Rapid Outbreak Management Team, those members are still on site and providing support. The support includes an infection prevention control specialist collaborating with the team at Parkland to manage the outbreak, along with public health. Another round of testing for Tucker Hall is slated for later this week. But the threat of COVID-19 is not only to the elderly and infirm. We have seen in recent days a large number of young people who have contracted the virus and have spread it to others by going to gatherings while infectious. D'autres cas feront surface au cours des prochains jours. Nous nous attendons à une autre augmentation de nombreux cas au cours des 7 à 10 prochains jours attribuables aux fêtes et aux rassemblements du Nouvel An. Je sais que la grande majorité des citoyens du Nouveau-Brunswick respectent les directives et les consignes de santé publique. In the coming days, there will be more cases. We expect there will be another spike in infections over the next week to 10 days, resulting from the New Year's Eve parties and gatherings. I know that the vast majority of New Brunswickers are following public health direction and guidance. I know that many of you have made personal sacrifices over the holidays to keep yourselves and your families safe, and I thank you for that. Many of you did not participate in long-standing family traditions to keep COVID-19 at bay, and I thank you for that. Many of you stayed at home when a winter vacation in the sun would have been more pleasant, and I thank you for that. Many of you had Zoom calls with faraway family, friends, and loved ones that you would rather have had seated at your holiday table, and I thank you for that. For all that you have done, you have my gratitude. But we must do more, and no one can be exempted. Bon nombre d'entre vous sont demeurés à la maison, même si des vacances hivernales au soleil auraient été bien plus amusantes. Bon nombre d'entre vous ont pris part à des appels Zoom avec des êtres chers qui habitent loin, plutôt que de les avoir à table près de vous pendant les fêtes. Je vous suis grandement reconnaissante pour tout ce que vous avez fait. Nous devons cependant tous en faire plus, tout sans exception. Everyone must strictly follow public health directions to keep the virus from spreading. Everyone must wear a mask in public places and maintain physical distance from one another. Everyone must avoid all but the most essential travel to other parts of New Brunswick and elsewhere in Canada and the world. Everyone must make themselves aware of the symptoms of COVID-19 and stay at home when symptoms emerge, no matter how mild they may seem. If you think you may have contacted COVID-19, get tested. Our testing lab has the capacity to conduct more tests than have been sought in recent days, so do not hesitate. Si vous croyez avoir contracté la COVID-19, faites-vous tester. Notre laboratoire de dépistage a la capacité d'effectuer un plus grand nombre d'analyses que ce qui a été demandé au cours des derniers jours, alors n'hésitez pas. I understand that people are tired of the COVID-19 virus, but the virus does not get tired. We must now dig deep and find the resilience that we all require to keep going. This is the challenge that stands before us, to keep the virus at bay until enough of us have had the vaccine that will bring this pandemic to an end. That day will come, but to get there, we must all work together, a little harder, sacrifice a little more, and look after ourselves and our loved ones with greater vigilance. We have done this before, and we can do it again, but we need to do it together, everyone doing their part. Nous avons déjà réussi à le faire et nous pourrons réussir à nouveau. Nous devons cependant travailler ensemble. Tous les citoyens doivent s'atteler à la tâche. Merci beaucoup.
Good afternoon and bonjour. Yesterday, we announced a record-breaking number of new COVID-19 cases in New Brunswick. Today, we have already broken that record again with 31 new cases. It is very possible that tomorrow will be another record-breaking day. Case numbers may rise. Case numbers may continue to rise in the days ahead, as they reflect activities that occurred during the holiday period. It is frightening to see the numbers increase like this. When we look to the jurisdictions that surround our province, we see how quickly cases can escalate. That can easily happen in New Brunswick if we're not careful. That is why we had to take action now and move the whole province to the orange level. These measures are the best way to contain the situation before it gets out of control. Some health zones currently have very few cases, and I know some people have questions about why the whole province has moved to orange. But our current situation demonstrates how quickly things can change. We can never forget that COVID-19 is all around us, and we have to take precautions now to slow the spread of the virus. We are all concerned by the new cases at Shannock's Tucker Hall in St. John. My thoughts are with the workers, residents, and families of this nursing home during this difficult and stressful time. I'm confident that the team at Shannock's is doing everything in their power to protect their residents, and I want to thank them for working so hard to contain the situation. We are continuing to roll out our vaccination plan this week, focusing on priority groups, including nursing home residents and workers. We are well prepared to administer vaccines to tens of thousands of New Brunswickers weekly. And that's exactly what we plan to do as soon as large numbers of the doses are made available to us by the federal government. As New Brunswickers begin to receive vaccines, we can see the light at the end of the tunnel, and I know we are all tired of living with restrictions. But now that New Brunswick is orange, we must stay within our single household bubble, we must practice physical distancing, and we need to wear a mask in public spaces, including outdoor spaces when physical distancing is not possible. If we obey these simple measures, I'm confident that we can quickly get New Brunswick back on track. By now, we are all familiar with these rules, but they will only work if we take them to heart and we follow them. We have moved out of red and orange levels over and over again since March, and we've done this by working collaboratively. We have had a great deal of success in keeping our cases low and protecting New Brunswickers, and we should all be very proud of what we have achieved. More vaccines are coming, but for the next few months, we must continue to be patient. We must continue to follow the rules that are in place. New Brunswick is an example to other regions across our country and around the world of what can be accomplished by working together. I'm very proud of how far we've come, but now, more than ever, we have to step up to protect our neighbors, friends, and family. The whole world is watching us. Let's show everyone what we're able to accomplish. Let's all do our part to get New Brunswick back to yellow as quickly as possible. Thank you. Merci.
Thank you, Minister Shephard. Dr. Russell. Merci beaucoup, Minister Shephard et Dr. Russell. We'll now proceed with questions from the media. You have the right to pose your question in the language of your choice. Please ensure your microphones are placed on mute. You will have one question and a very quick follow-up. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Voulez-vous assurer de désactiver le son de vos micros? Chaque journaliste aura une question et un suivi rapide. Tadil Ibrahim, CBC.
Thank you. This is a question for either Minister Shephard or Dr. Russell. Yesterday, Premier Hicks admonished a rural New Brunswick poker game. In yellow, we were allowed to have indoor gatherings unmasked of 20 people. So what rule specifically was actually broken in that situation? And does that game tell you anything about the clarity of public health guidelines?
So I'm going to say that I'm not quite sure when that outbreak was and if it was actually in a yellow or an orange phase. So our message is always consistent. Keep your contacts small. If you're showing symptoms, please don't expose yourself to other people. Get tested. Those are the things that we're really trying to convey. Thank you.
Thank you.
Ms. Ibrahim.
My follow-up is for Dr. Russell. Right now we have, oh, sorry, Dr. Russell, were you going to say something?
No, she's waiting for your
Okay.
follow-up.
Oh, so right now we have an outbreak in a nursing home and 31 new cases in one day. So what will it take to go to red in terms of single-day jumps and locations of infection?
Well, that's something that we're going to monitor on a daily basis. So between the epidemiology team and the medical officers with the public health team, we're all going to be, again, monitoring that situation right now. Obviously, the prompt team had success getting the last outbreak under control relatively quickly. So again, we're going to do our best to do that again. And yeah, we will keep monitoring the situation and looking at, mostly it'll be around the hospital capacity. And so that's probably the most important thing that we're going to be monitoring at this point in time.
Thank you, Doctor. Thank you, Ms. Ibrahim. Laura Brown, CTV.
Hi there. I'm wondering at what point are you guys looking into or considering rapid testing or rapid test clinics at this point?
I have heard people asking that question, and when I talk to my team, there isn't really a setting where we would do that, other than if it's directed at individuals in a certain situation by public health. But in terms of mass testing, we don't plan to do that at this point in time. Other situations where we have done it is where we were very suspicious of community transmission. In this Zone 5 outbreak, we did that. At this point in time, again, there would be specific situations that public health will direct that to happen. And when we talk about that kind of testing, it means that people are asymptomatic. But in most of the cases, we're really able to do the contact tracing, get people to stay put at home and do their self-isolation, and we're testing those people on day 10. and that's been working for us right now. I think if something changed and we saw that there was some community transmission that we really couldn't nail down, then we would look at that. But as of this point, we're not considering that.
Thank you, Doctor. Ms. Brown, do you have a follow-up today?
Wondering about the case origin. At this point, there's over 100 cases listed on the website that are under investigation. Do you feel confident that these clusters started with travel?
Well, if you look back over the entire pandemic, over 95% of our cases have been travel related. So here, few and far between have been community transmission, and it can take up to 4 weeks to determine the actual source. There's a lot of backwards contact tracing that happens as well. So our contact tracers are working very, very hard at this moment in time, and I have mentioned before that sometimes they have to interview the same people several times to get all the information they need to put together the pieces of the puzzle, because sometimes people actually don't remember the first time or the second time, so sometimes it's the third conversation that jogs people's memory. You know, we are aware that some people are feeling quite unwell when they are going through that questioning, and you know, again, everybody's just trying to do their job, and it's challenging, but at the end of the day, so far we have been successful at doing the type of contact tracing that we need to do to determine travel as a cause for COVID.
Thank you, Ms. Brown. Michel Corriveau, Radio-Canada. Michel Corriveau, Radio-Canada. Marie Sutherland, CBC.
Hi, good afternoon. My question is for Minister Shephard. Can you tell us which zone has the most healthcare workers isolating, and aside from elective surgery cancellations, what other impact is that having on healthcare services?
I only have the broad level details. I know that Upper River Valley Hospital is the hospital that has had to have some surgeries postponed or canceled. I will say postponed. And I don't know what zone the majority of the healthcare workers are self-isolating right now. I do have some numbers. So 73 in Horizon and 19 in Vitalité and 5 with Extramural and Ambulance New Brunswick. But again, I don't have which zones those are, just the regional health authority level.
Ms. Sutherland, do you have a follow-up?
I do. Question for Dr. Russell. Longer lockdowns are being explored and recommended elsewhere. I'm sure you know Scotland yesterday announced a 1-month lockdown. There's been a Canadian Shield report that's advised longer lockdowns. They're saying that the economic pain is less than with repeated stop and starts. Are longer or more restrictive lockdowns something you're considering at all, particularly given that it's been said that there's a significant risk that COVID-19 is no longer under control in the province?
Well, again, this is an evolving situation in terms of the number of cases right now and what we expect to see over the next 5 to 7 to 10 days. So, again, it's not easy to predict at this point how quickly we'll be able to get this contained. But what we do know is that over the course of the pandemic, through the first wave, through the summer, through the fall, each and every time we respond to outbreaks in zones, we have tried to tailor the measures to really target the risks. So the advantage that New Brunswick has had is taking a really close look at the data in terms of conversations with the regional staff around what they were seeing in terms of what was contributing to outbreaks. So when we saw that outbreaks were being caused by gatherings in Zone 5, we saw that's happening now. We saw some outbreaks being contributed to by people not wearing their masks at work. We addressed that. We saw that some outbreaks now are being perpetuated by symptomatic people attending gatherings, so we're addressing that now. So in terms of the balance between the restrictions and how severe those restrictions are, and the balance in terms of targeting the behaviors that will mitigate and address the risks, we've had a pretty good balance, and we've always managed to be able to have the measures in place in the orange phase from anywhere between 10 days to 4 weeks. And in between that, people have been able to function in the yellow phase quite comfortably. And so the only change right now in terms of that approach that I would consider is really, not even myself, in terms of the public health teams, is really around the new things to take into consideration around the risks, which include the UK variant and the risk to being able to continue to roll out our vaccine program as effectively and efficiently and swiftly as possible. But other than that, we have been comfortable with the changes that we've made over time around which measures, how stringent they need to be to manage the risks and contain outbreaks.
Thank you, Ms. Sutherland. Thank you, Doctor. Travis Fortnum, Global TV.
Hi there. My questions are also for Dr. Russell. Regarding the outbreak inside Tucker Hall, you mentioned cases are popping up in areas of the facility that haven't seen them so far, this outbreak. Are these cases linked to the ongoing outbreak, or how did they get started?
Are you talking about the Tucker Hall areas?
Yeah.
In Parkland, in that Shannex? Again, I don't have the information on all of that. I just know that the contact tracing is being done, the isolation and cohorting is being done. The prompt team is on the ground testing the staff and the residents every couple of days. So in terms of the process and the approach, that is still evolving, but again, reacting and responding to the information that we receive on a daily basis.
Mr. Fortnum, do you have a follow-up?
Yes. Yesterday, Premier Higgs said that we could soon see hundreds of cases a day. Are we going to see over 100 a day before things start to get better this way?
Well, I think what he was referring to is that if we didn't go to orange, that is what could happen. While we are in orange, could it still happen? Hopefully not. I think the one unknown at this moment in time is that we just still haven't seen the case numbers that we know are going to increase based solely on New Year's Eve gatherings. So when we factor in those extra cases in terms of where clusters and outbreaks are seen and how that can be managed at the same time as the ones that we're still managing from the Christmas time frame, because as we mentioned earlier, there's secondary transmission now from those cases. And again, that's why we keep looking at every 14 days being the incubation period. We're going to keep seeing transmission just between the cases where they hadn't self-isolated already by the time they had been diagnosed. So again, we want to get ahead of it and stay ahead of it. That's obviously the goal, but we're not out of the woods yet in terms of, again, seeing what's going to happen with the New Year's Eve gathering cases. And again, I expect to see those over the weekend. And so by Monday, I think we'll have a much better idea of where we are in managing the outbreaks and clusters right now.
Thank you, Doctor. Thank you, Mr. Fortnum. Margot Castada-Acobari, Radio-Canada.
Oui, bonjour. Cette question est pour la Dr. Russell. Je sais que vous avez répondu en anglais, mais j'aimerais y revenir en français, s'il vous plaît. Qu'est-ce que ça prendrait pour aller en zone rouge et considérez-vous annoncer d'autres mesures pour contenir ces éclosions?
Ça dépend à ce moment-ci la manière que ça déroule au niveau des nouveaux cas, la situation avec les rassemblements de la veille de l'an à ce moment-ci. Et dans les prochaines 5 à 7 à 10 jours, on va voir un portrait de ces nouveaux cas en combinaison avec les cas qu'on essaie de gérer à ce moment-ci. Les choses que nous inquiètent le plus en regardant les différentes mesures, c'est vraiment si les impacts au système de santé sont très, très négatifs au niveau de soit la capacité au niveau des soins intensifs et les chambres et les lits qui sont disponibles. Mais aussi, c'est toujours un problème pour s'il y a beaucoup de travailleurs de santé qui sont impactés, soit parce qu'ils sont infectés avec le COVID-19 ou soit parce qu'ils sont en contact étroit avec un cas de COVID. Alors, si c'est le cas, ça veut dire qu'il y aura plusieurs travailleurs de santé qui ne seront pas capables de travailler et ça aura un impact sur la capacité de le système de santé.
Si Dr. Margot, as-tu un suivi?
Oui, en parlant du système de santé, pouvez-vous juste rappeler combien de personnes dans le système de santé sont touchées et combien au complexe Chanex sont impactés?
Je sais en total, avec Horizon, puis Vitalité, puis Ambulance Nouveau-Brunswick et aussi le programme extramural, il y a environ 96 en total. Mais je ne sais pas exactement combien qui sont au Chanex, mais je vais juste vérifier parce que je crois que c'était sur mes notes. Oh. Je sais seulement le nombre pour aujourd'hui. Je crois qu'il y avait 11 cas nouveaux des résidents et 3 nouveaux cas de résidents juste aujourd'hui, mais je ne sais pas le total. Mais je peux revenir avec ça.
Merci.
Merci. Et c'était 97, pas 96. Alors, pour le Chanex, c'est 4 employés et 11 résidents, mais je croyais que ça, c'était juste pour aujourd'hui, mais si c'est en total, je vais revenir avec les totals.
Mathieu Roy,
Et pour les travailleurs de la santé, c'est donc 97.
Oui, oui.
Merci.
Merci.
Merci Margot. Mathieu Roy, Como, l'Acadie Nouvelle.
Bonjour, je crois bien que ma question est pour Dr. Russell. Êtes-vous capable, je comprends bien là, que la recherche de contact se poursuit, mais en ce moment, selon les données, êtes-vous capable de me dire combien il y a d'éclosions différentes au Nouveau-Brunswick?
Ça dépend. Au commencement, il y en avait un dans la zone 3. Après ça, il y en avait 3 en total, un en zone 3 puis 2 en zone 1. Si on compte l'éclosion au Chanex, ça serait 4, mais je peux revenir avec cette information maintenant. Mais ça, c'est les plus nombreux de cas on voit maintenant, c'est la zone 1, 2 et 3.
Monsieur Roy, comment as-tu suivi?
Oui, merci Bruce. On se doute que le Québec annoncera probablement tout à l'heure un couvre-feu. Évidemment, la situation au Nouveau-Brunswick n'est pas aussi grave qu'au Québec, mais je me demandais si le Nouveau-Brunswick avait déjà envisagé un couvre-feu ou sous quelles conditions on imposerait un couvre-feu à la population.
So I'll take that question because there is some conversation happening with the COVID cabinet, all-party committee, and cabinet itself, and with our teams at Public Health and Health. It's not in the queue right now, but we're not eliminating any kind of options for what we can do to control the spread of this, pending how we roll out from today. As Dr. Russell has indicated, we have numbers yet to see as a consequence of our New Year's Eve gatherings, and so everyone has had this time, and we knew that there would be some consequence from it. And again, it's all about protecting our healthcare system and knowing that we can still provide urgent services to our people. So it's certainly not a conversation we haven't had. There are no decisions on that yet.
Thank you. Merci beaucoup. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell or Minister Shephard. I understand the Moderna vaccine is a 2-dose vaccine, but are you able to give the first dose to residents from Parkland and St. John who test negative to help prevent spread? Is that a strategy that can be implemented at long-term care homes where there are outbreaks?
So as the vaccines are becoming available to us, we are planning clinics in the areas. With regards to the St. John area, we know that we're going to have clinics coming up in the week of January the 7th, I believe. We're receiving that, and then the clinics are a few days after that. So I can't tell you today if members of Chanex are going to be involved in that. I know nursing home residents are certainly going to be involved in that, and I'm not sure if Dr. Russell can add anything more to it, but we will certainly be rolling them out as quickly as we can.
We have had conversations about the hypothetical situation of whether or not we would vaccinate a facility that was in an outbreak status. And I'm not sure how far we got with that. So I would have to come back to you. I don't think that's the case right now, that we would immunize when there's an outbreak. But again, I know that conversations have taken place, and so I can get back to you on that.
Thank you, Minister. Thank you, Doctor. Ms. Hogarth, do you have a quick follow-up today?
I do. I'm just wondering if you have an update on the next number of vaccines we expect to receive in the coming week.
I have that printout. We have great planning cells for all of the vaccination rollout in phase 1, phase 2, and phase 3. So we have really great clarity on when things are being delivered. My understanding is that we have from the week of January 4th to the week of January 11th, we were supposed to receive 2,700 doses of Moderna and 2,925 doses of Pfizer. Is that what you were looking for, Vicki?
Yes, thank you.
Bobby Jean McKinnon, CBC.
Yes, hello. Minister Shephard, at least 4 employees at Shannock Tucker Hall have tested positive now, and the unions have said many healthcare workers work at multiple nursing homes to make ends meet because they can't get full-time work. They've called on the government to follow the lead of other provinces and limit workers to one facility without any loss of pay to help prevent the spread of COVID, and to provide administrative leave pay for those who are asked to self-isolate for the same reason. What can you tell us about where the government stands on these issues?
So I know that during an outbreak, and certainly when we have a case that is declared, all employees are segregated to be working only at one institution or one residence. So that has been a policy since, the early on in the beginning of COVID. What I can tell you, what I really can't tell you is how far these conversations have gone, because as you know, social development would lead those conversations. But we will get you some information on that and get back to you.
I'm just going to come back to this question around vaccinating nursing homes or long-term care facilities during an outbreak. Technically, obviously, the first dose of either Moderna or Pfizer doesn't really take effect for at least a week, if not 2 weeks, until that first dose has been given. So in terms of protection, immediately during an outbreak setting, that you wouldn't be getting that kind of protection. That's not to say that it's not important to vaccinate people anyway, despite the outbreak, but it certainly wouldn't be as a protective measure for that particular outbreak that was happening at that time.
Thank you. Ms. McKinnon, did you have a follow-up?
Yes, thank you. Dr. Russell, you and Senior Higgs have said repeatedly that most New Brunswickers are compliant and that it's simply not possible to enforce the rules completely. How optimistic are you that being in this stricter orange level of recovery will actually help stop the spread?
Well, it's worked in all of the other outbreaks, so that's one thing that we're optimistic about. But certainly, as Minister Shephard pointed out, that again, this is a unique situation in terms of the number of cases, record-breaking cases around the province, happening just after the holiday period, worrying about the UK variant being introduced to New Brunswick at any time, as it is in 30 different countries around the world. So, you know, yes, orange has worked in the past. Will it work this time? I don't know. We have tried to match our stringency measures and direction with the risks that are identified. So we will continue to do that. And if it requires more measures than what we've got in place right now, then we will certainly have those conversations with the COVID-19 Cabinet Committee. But it is an evolving situation, and we are very concerned right now about it. And whatever everybody needs to do on an individual basis, we really do need people to dig deep and do the right thing, no matter how difficult it is right now. But certainly that's why we need to be supportive of one another and be able to lean on each other and reach out to other people for support, because this isn't an easy time. I've had conversations with my teenagers about the orange phase this time. They recently were in orange prior to Christmas. They try to roll with the punches, but everybody's different and everybody's in a different place, and this affects people in different ways. So we do have to be sensitive to that, while at the same time understanding that this is a very serious situation that could rapidly change, and the numbers can go up exponentially in a very short amount of time. And I think that's the part where we don't want to instill that much fear that people are terrified, but honestly, the numbers can go so high. We can look like other provinces and jurisdictions and countries, and we just don't want to do that. So we want to do everything possible to avoid that, again, while trying to maintain the economy, while trying to protect people's mental health, while allowing children to go to school, et cetera. So we have some balances and checks in place right now. We're very hopeful that this is going to get things under control in a very swift manner. And again, all we can do is keep monitoring and making decisions based on new information that we receive.
Thank you, Doctor. Thank you, Ms. McKinnon. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. Ottawa's medical officer of health is stating that she wants masks to be mandated outdoors as much as possible. New Brunswick has adopted this for areas in orange zones for more than 3 months. Has it worked so far, and would you recommend other provinces like Ontario follow suit?
Well, all the information that we've discussed throughout the pandemic has really been a collaborative effort and conversation at the national level with our counterparts at the Public Health Agency of Canada, Health Canada, as well as all the chief medical officers of health in the country, and our teams on the ground in each jurisdiction. The benefit of those conversations and the technical information that we're able to share with one another is that we do have the ability to tailor that to our own risks and our own epidemiology, et cetera. So for us, outdoor masking was really important when we identified risks of gatherings that were happening outdoors where people weren't again, we were trying to address the risks that we were seeing in our province in terms of outdoor gatherings, et cetera. So again, I can't speak for other jurisdictions. I can just say that we get really great information shared amongst the provinces and jurisdictions through those regular meetings. All that technical information is shared around the benefits and the science and what is supporting that kind of evidence. But again, every jurisdiction has the ability to tailor that, take that information and tailor their approaches based on their own jurisdiction's epidemiology, et cetera, and risks.
Thank you. Did I give her a
I have another question for Dr. Russell. What data do you have to back up statements that a large number of young people have been gathering and spreading the virus?
Well, I have regular meetings on a daily basis with my public health team, my epidemiologists. We all have conversations around what they're seeing in the regions, around what is contributing to the outbreaks. And that's the best way for us to be able to communicate the risks to the public. And we do know that the testing numbers had been low over the holiday season. We do want to get the testing numbers back up. We do want people to be aware that if they have mild symptoms, they really need to get tested. And when we do our risk assessments, we do look at patterns of transmission. These inform our decisions and discussions on many different levels on a go-forward basis, because we factor in what it is that we need to do moving forward. You know, prior to Christmas, the Christmas holiday season, Halifax was seeing community transmission and a lot of cases in the younger population between ages up to age 39. So that was definitely happening. At this point in time, we're seeing cases across many age groups. You know, and each age group has its unique features and risks and different ways of managing and mitigating. So we're just, again, really trying to address the risks, really trying to help people understand what they can do individually and collectively to stop the spread of COVID at this moment in time.
Thank you, Ms. Fraser. Savannah Odd, Telegraph Journal.
Hi there.
I'm not sure who my question is for, actually, probably either of you. Dr. Russell had mentioned hospital capacity concerns and 97 healthcare workers who are isolating now. In terms of the number of staff isolating, at what point do we need to worry about capacity for COVID care or regular care at hospitals becoming insufficient?
So I'll take that one, Savannah. You know, the RHAs have a really good handle on this, and they're monitoring it. Back when we had the outbreak in St. John, I think at one point we were 108 staff that were out throughout Horizon, and you know, Horizon and Vitalite actually partnered up and supported each other during that time. And I think that the RHAs have a good working relationship, that they make sure that staffing is a good complement. The elective surgeries, things like that may have to get postponed or rescheduled are a natural thing that could happen when any healthcare system has been compromised with resources, human resources. So I think will be ongoing. It will change from time to time. I don't know what that critical number is, because it will depend on where it happens and to how much it affects, you know, a larger hospital or a more urban hospital. So I can't define that number for you, but I can say that it's been a little worse. We don't want it to get worse. And I have confidence that the RHAs will keep us in the loop and help us to determine when things need to change.
Thank you, Minister. Ms. Odd, do you have a follow-up today?
I do. Thank you, Bruce. You both have said this is a very serious situation. Of course, we don't want it to get worse. But, I mean, if it does, if cases are increasing as Dr. Russell anticipates, can you explain in real terms what that means for people trying to access care in the system? Are we looking at a reduced ability to treat emergencies or give any kind of specialized care? I know you mentioned elective surgery, but are there other implications as well?
I'm just going to go off of the knowledge that I have of the system at this moment, and I'm going to say that elective surgeries, of course, I think would probably be the first. I think we're going to do everything possible to ensure that urgent care is maintained. We may have hospital beds that you know, that we can't access as quickly as we need to. My biggest concern, from what I know, would be the ICU units. We have a tremendous amount right now of elderly individuals who are infected with COVID-19, and we want to ensure that we have the ability to care for them if urgent care is needed. So I guess I would say what I think we would be protecting first would be urgent care, and keep as many systems on the go as we can. And closing and or postponings would be a last resort.
So I'll just add to what Minister Shephard said. Obviously, in the first wave, when we were in the red phase of recovery, there was a drastic reduction in services provided at all hospitals. They were practically emptied out to make room for a potential surge in COVID-19 cases. At this point in time, again, it's twofold. The risks is one on the healthcare side in terms of healthcare providers, and it's also on admissions and the requirement to have ICU beds available. When we were in the Zone 5 outbreak, the Vitalite had actually done modeling and projections to determine that, you know, with so many cases active at one time and so many people in certain age groups, you could try to project out over the course of a week to 2 weeks how quickly hospital beds and ICU beds would fill up based on the knowledge that a certain percentage will need hospitalization in ICU beds.
Thank you, Ms. Odd. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you.